Boris Johnson is at the podium.
In the 2 weeks since I last addressed you from this podium, I'm pleased to report that we've continued to make steady progress in our collective effort to beat the coronavirus. For 3 weeks now, the number of new cases identified through testing each day has been below 1,000. The latest SAGE advice is that across the UK, the R rate remains between 0.7 and 0.9. SAGE also assess that the number of infections is shrinking by between 5 and 1% every day. The latest ONS data shows prevalence and new infections to be stable and low. The number of patients newly admitted to hospital with coronavirus each day and the number of coronavirus patients in mechanical ventilation beds have both fallen by more than 90% from their peak in early April. And while we mourn every death, the average daily death rate continues steadily to fall. This progress is testament to the phenomenal efforts of our NHS and social care staff working tirelessly on the front line. And it has only been possible thanks to the character and fortitude with which you, the British people, have made fundamental changes to the way you all live and work. When we set out our plan to rebuild on the 11th of May, we said that our goal was to return to life as close to normal as possible for as many people as possible, as fast and as fairly as possible, in a way that is safe and that continues to protect our NHS. That goal remains the same, but the tools we use to achieve it are changing. At the start of the pandemic, we knew far less about the nature and the spread of the virus, and we had to take blanket national measures. National lockdown was undoubtedly the right thing to do and has saved many thousands of lives. Now, however, we know more about the virus, we understand the epidemiology better, and our intelligence on where it is spreading is vastly improved. That means we can control it through targeted local action instead. In England, this work is led by NHS Test and Trace and, within it, the Joint Biosecurity Centre. My deep thanks go to Dido Harding, who oversees this work and who joins me today. This approach is already working. In Weston-super-Mare and Kirklees, we took swift and successful action to contain outbreaks at specific premises. In Bradford and Blackburn with Darwin, we identified troubling trends in the data and worked closely with respective local authorities to increase testing and take targeted action. That work continues. And in Leicester, we instituted a local lockdown in order to bear down on stubborn rates of infection. As the Health Secretary announced last night, we will begin to relax the restrictions there next week. We can do so because the data is improving, with the percentage of people testing positive falling from a weekly rate of 12.2% on the 29th of June to 4.8% yesterday. The approach varies in different parts of the UK, but all parts of the UK benefit from the support of our armed forces, additional testing facilities, and billions of pounds of support provided by this government. Today, we are publishing our framework for containing and controlling future outbreaks in England, which will enable national and local government to work closely together. From tomorrow, local authorities will have new powers in their areas. They will be able to close specific premises, shut public outdoor spaces, and cancel events. These powers will enable local authorities to act more quickly in response to outbreaks where speed is paramount. Action by local councils will not always be sufficient, so next week we will publish draft regulations which clearly set out how central government can intervene more effectively at a local level. Where justified by the evidence, ministers will be able to close whole sectors or types of premises in an area, introduce local stay-at-home orders, prevent people entering or leaving defined areas, reduce the maximum size of gatherings beyond national rules, or restrict transport systems serving local areas. I know it will be hard going for people affected by these local measures. It isn't easy, and for some it may seem unjust that people just a short distance away can live their lives closer to normal. But it has to be right that we take local action in response to local outbreaks. There is no point in shutting down a city in one part of the country to contain an outbreak in another part of the country. Now, of course, this local approach relies on having an effective testing regime in place. And here we have made substantial progress. Antigen test capacity, that's the test which tells you if you currently have the virus, has increased 100-fold since the start of March, from fewer than 2,000 tests a day to more than 200,000 tests a day now. Publicly available data suggests we are now carrying out our tests more than anywhere else in Europe in total, and more tests than Germany, France, Italy, and Spain per capita. We've set up testing sites around the UK and now have 200 mobile units which can be rapidly deployed wherever they're needed. It's now the case, and has been for some time, that anyone, anywhere in the UK with symptoms can get a test without delay. We're also testing increasing numbers of people who don't have symptoms but who are at higher risk. As we approach winter, we will need to go further, not least as many more people will show COVID-like symptoms as a result of seasonal illnesses and therefore require a test. So we will further increase testing capacity to at least 500,000 antigen tests a day, that's 3.5 million antigen tests a week, by the end of October. Demand for testing is not the only challenge that winter will bring. It's possible that the virus will be more virulent in the winter months, and it's certain that the NHS will face the usual annual winter pressures. We've taken a number of steps, therefore, to get the NHS ready for winter. We have massively increased the number of ventilators available to patients across the UK, up from 9,000 before the pandemic to nearly 30,000 now. We've substantially increased the pipeline of personal protective equipment for the NHS and social care, constituting over 30 billion items of PPE over the course of the pandemic. We will be rolling out the biggest ever flu vaccination programme in the history of the UK. We will also, of course, give the NHS the resources it needs. And today I can confirm that we're providing an additional £3 billion of funding to the NHS in England to get ready for winter. Scotland, Wales and Northern Ireland will also receive additional funds. This will allow the NHS to continue to use the extra hospital capacity acquired from the independent sector and also to maintain the Nightingale hospitals until the end of March. This new funding comes on top of the additional £30 billion of funding for health and social care that we've already announced this year. So we're making sure we're ready for winter and planning for the worst. But even as we plan for the worst, I strongly believe we should also hope for the best. That means looking ahead with optimism, now extending our plan to lift the remaining national measures which have restricted our lives since March, so we can get back to something closer to normal life. Now, I must stress the timetable I am about to set out is conditional. It is contingent on every one of us staying alert and acting responsibly. It relies on our continued success in controlling the virus, and we will not proceed if doing so risks a second peak that would overwhelm the NHS. Nonetheless, it is important to give people hope and to give business confidence. So, in England, from today, we are making clear that anybody may use public transport, while of course encouraging people to consider alternative means of transport where they are available. From the 25th of this month, July, we've already committed to reopening indoor gyms, pools and other sports facilities. From the 1st of August, we will update our advice on going to work. Instead of government telling people to work from home, we're going to give employers more discretion and ask them to make decisions about how their staff can work safely. That could mean, of course, continuing to work from home, which is one way of working safely, and which has worked for many employers and employees. Or it could mean making workplaces safe by following COVID-secure guidelines. Whatever employers decide, they should consult closely with their employees and only ask people to return to their place of work if it is safe. As we reopen our society and economy, it's right that we give employers more discretion while continuing to ensure that employees are kept safe. Also, from the 1st of August, we will reopen most remaining leisure settings, namely bowling, skating rinks, casinos, and we will enable close contact services, beauticians to resume. Nightclubs, soft play areas sadly need to remain closed for now, though this will be kept under review. We will restart indoor performances to a live audience, subject to the success of pilots, and we will also pilot larger gatherings in venues like sports stadia with a view to a wider reopening in the autumn. We will also allow wedding receptions for up to 30 people. All of these measures for the 1st of August should be done in a COVID-secure way. In September, schools, nurseries and colleges will be open for all children and young people on a full-time basis as planned. And universities are also working to reopen as fully as possible. From October, we intend to bring back audiences in stadia and to allow conferences and other business events to recommence. Again, these changes must be done in a COVID-secure way, subject to the successful outcome of pilots. Throughout this period, we will look to allow more close contact between friends and family where we can. It is my strong and sincere hope that we will be able to review the outstanding restrictions and allow a more significant return to normality from November at the earliest, possibly in time for Christmas. At all times, we will continue to work with the devolved administrations in Scotland, Wales and Northern Ireland to support and care for those at risk, wherever they live in the UK. We've said that the shielding programme for those most at risk in England, the clinically extremely vulnerable, will be paused at the end of this month. We will stay constantly vigilant and be sure to restart shielding at any point if required. Now, I know some will say this plan is too optimistic, that the risks are too great, and that we won't overcome the virus in time. And of course, if they are right in saying that, and we cannot exclude that they are, let me reassure them and reassure you that we will not hesitate at any stage to put on the brakes. From May the 11th onwards, this plan has been conditional, and it remains conditional. But if we continue to pull together, as we have done so far, I know we can beat this virus. Hoping for the best, but planning for the worst. And it's in that spirit that we must carry on waging this long, hard fight against coronavirus. And I'll now hand over to Dido.
Thank you, Prime Minister. Firstly, I want to set out how far NHS Test and Trace has come in just 6 weeks. In the last 6 weeks, just under 2 million people have been tested for coronavirus, and over 34,000 have tested positive. We have contacted over 180,000 people who might otherwise have unknowingly spread the virus further. Over 30,000 people have given us their feedback, and 87% were satisfied or very satisfied with the service. And when you get a test in person, you can be confident that you will get the test result the very next day. Every week, NHS Test and Trace gets better, and we're working hard to keep improving. None of this would be possible without the support of the British public, who have come forward to get tested and responded when we get in touch. So I want to say thank you. This virus is challenging for all of us, wherever we live, whatever we do. Coronavirus hasn't gone, but it is now under control. And the best way to keep it like that is to work locally together to stop the spread further. Today's Contain framework is all about that. It shows how we will work in partnership with local authorities, Public Health England, the wider NHS, local business and community partners, and you, the public, to take action at a local level. We already have countless examples of this happening across the country right now. In Leicester, hundreds of local council and NHS staff have visited people at home to offer them a test there and then. In Bradford, over 100 community influencers and faith leaders have come together to ensure that everyone has the information in their own language in a way that works for them. And across the country, thousands of pubs, cafes and restaurants are now keeping records of customers so that we can quickly respond if someone gets sick. Each week, over 100 local outbreaks are being successfully managed by local authorities and Public Health England teams and community partners. And this new framework will make it even easier for them to do what's right for their people with our backing and support. There is lots more for NHS Test and Trace to do. We will keep growing so we can offer 500,000 tests a day by the end of October. We will launch an app and backwards contact tracing to find the source of outbreaks, and we will recruit more people to work in local health protection teams. Making sure that NHS Test and Trace is ready for winter is the job for me and my team to do over the summer. But NHS Test and Trace depends on all of us acting responsibly. If you get symptoms, please get a test and help us reach anyone you will have been in contact with. I'm sure that this is how we can best protect our families, friends, colleagues, and our local communities, and all get back to do what we love the best. Thank you.
Thank you very much, Dido. And thanks to everything you're doing. Thank you to all your team at NHS Test and Trace. Let's go first to Jane from Mansfield.
Her Majesty's Government are preparing for a second wave in terms of securing PPE and looking at capacity in the NHS. Are there things the general public should be doing to also prepare?
Well, thanks very much, Jane. Yes, I think the most important thing everybody should be doing is thinking about the basic things we can do to protect ourselves and to protect everybody else. So all the washing your hands, observing social distancing, using face coverings on public transport or in shops, the basics to stop the spread of the disease. Those will be so powerful. They have been so powerful in getting the disease down in the way that we have. It's been a huge public act of coming together that has really made this possible. We now have some extra tools, of course, at our disposal. The new powers that I've just announced for local government, for national government to do local lockdowns, the vastly improved capacity we now have for testing, the NHS Test and Trace operation. There are also, of course, new drugs, preparations, therapies for the disease that we didn't have at the outbreak. But the single most powerful thing we can all do is to continue to follow that basic guidance. Anything you want to add?
Just if you don't feel well, if you have a temperature, a persistent cough, you've lost or changed your sense of taste or smell, get a test. Whoever you are, whatever you do, however old or young, if you're in doubt, get a test. That's probably the most important thing you can do to help NHS Test and Trace contain the virus. And
we can get the result of that test back within 24 hours?
Yes, you will get the result. If you come to one of our face-to-face testing centres, you'll get the result the next day.
Thanks very much, Dido. Thank you, Jane. Victoria from Tadcaster has written, you're urging people to go back to work if they can. However, our main childcare providers are grandparents. That means we must stay 1 metre from within households. Within households, do you plan to scrap the 1 metre distance rule within households and allow them to provide childcare, and in turn more people will be able to return to work? Well, Victoria, it's a very, very good question. I think the answer there is that I think your grandparents your children's grandparents would count as part of the bubble that you're forming with, as it were, within with two households indoors. So I think you'd be okay, Victoria, I can tell you'd be okay to continue with those childcare arrangements within your household. I think what we're trying to say about the 1 metre rule generally and social distancing generally is that clearly looking through till the spring, looking through to the long-term impacts that social distancing will continue to have on many sectors of the UK economy, what we're saying is that we hope that by November, at the earliest, if we can continue to make progress in our struggle against the virus, then it may conceivably be possible to move away from the social distancing measures, from the 1 metre rule and other things by that time. Now, that is entirely conditional, as I say, on our ability to continue to keep the virus under control. But I think on your childcare, Victoria, you're going to be all right. Can we go to questions now from the media? Vicky Young from the BBC.
Prime Minister, some companies have said to their workers that they don't need to be back in the office until January. Are you now saying that employers should be doing more to encourage workers back in August? And if so, how does that fit with the advice from the chief scientific advisor, who said yesterday he saw absolutely no reason to change the advice that says work from home if you can? And a second question, if I may, about the Health Secretary, who's ordered an urgent review into the way that death statistics have been compiled in England. Do you have confidence in the work of Public Health England? Well,
thanks very much, Vicky. Look, on I totally agree with Sir Patrick Vallance on what he's saying. Obviously, it's not for government to decide how employers should run their companies and whether they want their workforces in the office or not. That's very much for companies. And what we're saying now is that if employers think it'd be better and more productive for their employees to come into the office and they can work in a safe way, in a COVID secure way in the office, then there should be discussions between the employers and employees, and people should take a decision. And what we're saying is that we want to encourage people to think it is safe to come in to work, provided employers have done the work they should have done to make their premises COVID secure in the way that so many businesses up and down the country have already done. So that's what we want to see from the 1st of August. Discussions between employers and employees about how they think people can be most productive, and if everybody thinks that it can be done safely, if people think that the place of work is safe, then of course people should come in if that is what the decision is. But it's not for government to make that decision. If people are very productive at home, and I think there's been a huge amount of people have discovered a lot of different ways of working in the last few months, and some people have been extremely productive from home, and I think new patterns of work have been emerging. I think many, as you began your question, many companies are seeing opportunities to do things differently. But where employers think it's now time to get people back, and certainly they will want to be seeing people coming back into the civil service here in London, where employers think it's time to come back and it can be done in a safe way, then that is what we think they should be doing. But it's for them and their employees to decide. On the statistics, that I think Matt Hancock is going to be doing a review of those statistics and with Public Health England. Thank you very much, Vicky. Let's go to Beth Rigby of Sky.
Thank you, Prime Minister. On the one hand, you've just said that you think the virus could become more virulent as we head into the winter. And yet you're also still easing restrictions as well. Are Sir Patrick and Chris Whitty not here with you today to explain the public health and scientific considerations behind these decisions? Because they are two of the people, to quote you, who believe this plan is too optimistic and the risks are too great.
No, Chris and Patrick are I think, giving evidence to the Lords and doing lots of things today. In fact, they briefed the cabinet earlier on today on these plans. But I must stress that the chief scientific advisor, the chief medical officer, give us advice, which we, of course, take very, very seriously. But in the end, decisions are taken by the elected politicians. We have to weigh the advice that we get. And I don't think that our wonderful scientific and medical advisors would want to take those decisions for us. Those are decisions for us to take. And I think people should understand the balance of what we're saying. What we're saying is that where employers decide with their employees that it's safe to come back to work, then people should come back to work, and provided that that can be done in a COVID secure way. Thanks very much, Beth. We're going to go to Carl Dinnan from ITV.
Prime Minister, yesterday, as you know, Sir Patrick Vallance said there was no reason to change the advice on working from home. Today you changed it. Has something happened in the meantime that has meant that you can now change that advice? And as you say, that it will now be left up to employers to decide whether or not their employees come. If the government doesn't have a view on whether or not it's safe to work from home or work from the office, how are employers supposed to make that decision?
No, sorry, the government certainly has a view about whether it's safe. And our view is whether that it is safe, provided employers have taken the steps that they need to take, which of course will be invigilated by the Health and Safety Executive to make sure that their place of work is COVID secure. If they've taken those steps, if the place of work is COVID secure, then our view is that it is safe. But whether people should go into work, whether they need to go into work, is not something that the government can decide. It is up to employers to decide with their employees whether they think the time has come for them to be more productive in a place of work for a greater portion of the week than staying at home. As I said, Carl, we've learned all sorts of lessons over the last few months about the wonders of Zoom and muting and unmuting our colleagues and all the rest of it, and it's fantastic. And here we are, communicating in a way we never would have dreamed was possible only a few years ago. It's a miracle. But in the end, human interaction, face-to-face conversations are important. Many businesses tell me that. What we're saying is from the 1st of August, if they can talk to their employees, if everybody can discuss it in a serious and grown-up way, if we can be confident that the places of work are COVID secure, which I'm sure we can, then employers working with their employees should be encouraging people to get back to work where that is right for that employee. That's what we're saying. And they should use public transport if they need to, though, of course, where possible, alternative means should also be used. Okay? Thank you very much. Let's go to Jim Pickard of the FT.
You're 400,000. How many of those do you want to go back to working in, and when? And for Harding, the Prime Minister said in March that antibody tests were going to be the game changer for the pandemic. The government's ordered 1 million tests. Only 1 million have been done so far. Those done with health workers and care home staff. When are you planning to roll that out in the community, or have you concluded that this is not a game changer after all?
Well, I'll hand over to Dido on the antibody test in a minute. But Jim, thank you. I notice it says your network bandwidth is low, and I apologise for that, because one of our tasks as government is to get gigabit connection for everybody by 2025, and we will be rolling that out, Jim. I'm surprised the FT can't lash out on some proper connections for you, by the way. But anyway, we really do want to improve general people's connectivity, because I do think that we've made huge progress, and that actually affects the answer to the question about how many of the 400,000. I think the question was about the 400,000 wonderful civil servants in Whitehall should be coming back. Again, it will depend on the line managers. It will depend on who can, where people need to be. That's a discussion to be had between employers and employees about how you can be most productive and effective. And I think there's a balance, and we've learned huge lessons throughout this crisis about the potential of technology, but I think there are also limits, as we're also seeing, to technology, and sometimes no substitute for face-to-face meetings and interaction. So that's, I think, what many employers will be starting to say from the 1st of August. And Dido, on
antibody tests, rather similar to the Prime Minister's answer on technology, science also has its limits. So we've tested over 1 million people for the antibody test in health and social care in only a few weeks, continuing to roll that out to people working in the NHS and social care. But at this stage, the science isn't clear enough yet to tell us whether or not the presence of antibodies and the level of antibodies in your blood gives you immunity. And so at this stage, the actual only information that you get from an antibody test is that you have or haven't got antibodies. And we're learning all the time, thanks to all of those health and social care workers participating in the studies and having those antibody tests done. But at this stage, it's too early to be able to say that it is or isn't a game changer. I think we all want it to be. Everyone wants to believe that we will find that sort of silver bullet in the science that means that we know that we're going to be safe, particularly for people who've suffered and been very ill. But at this stage, we don't know that yet, and so there are no plans immediately to extend that antibody testing unless or until the science gives us that answer we're searching for.
Yes, and perhaps I should just add that what I intended by that is the game changer is, I think, there are several things that could be game changer. A vaccine would obviously be a game changer, but I also think that test and trace and our ability to detect the outbreaks at a local level in real time, as it were, and the closer we can get to pretty much instantaneous detection of outbreaks, and we're making progress the whole time, the better we will become at preventing a more general outbreak and containing it faster and faster. And so testing and tracking and tracing have got much better in the last couple of months it's been, and I've no doubt that by October, November, when obviously there will be the winter pressures that I've described, it will be even stronger and even more resilient and useful. Can we go to Jane Merrick of the Eye, please?
Thank you, Prime Minister. You mentioned November as a landmark month for getting back to normal, and many people, families across the country, will be thinking about Christmas. How optimistic are you that families, including grandparents, will be able to gather around the Christmas table and spend Christmas together? And secondly, last month, SAGE's Behavioural Science Subcommittee published a report which concluded that there has been a recent decline in the credibility of and trust in the government in relation to the pandemic. Are you concerned about this, and how do you convince the public to listen to what you're saying, given that conclusion?
Well, thanks very much, Jane. What we want is for everybody, and you've got it completely about Christmas, because it's not only a very important time of year for families, it's also a very important time of year for the UK economy and for many millions of people working in all kinds of sectors, many of them on modest incomes, and it's very important that we hope for the best Jane. That's what I'm trying to set out today. A plan where we hope for the best, but plan for the worst. And clearly, the steps that we're taking for September, October, November, they're all conditional on our continued ability to defeat the virus. And just on your last point, the way we've defeated the virus so far has been through the massive common sense of the British people and their ability to see what needs to be done and to do it. And that is how we've reduced the number of deaths, the number of hospital admissions, and have got the virus to the stage it is at. And of course, Jane, if you look at other countries around the world, I must say this in all candour to the British people. They look at other countries around the world, we can see all too clearly what could go wrong if we don't continue to follow the guidance, if we don't continue to keep this thing under control, because plainly this is a very contagious illness, and there are parts of the world where it's continuing to spike. We don't want to see that in this country. We think we have a new panoply of tools that will enable us to fight it. The local lockdowns, the measures we're bringing in, the contain framework, test and trace, new drugs, new therapies. But in the end, the real secret is in the common sense and the collective action of the British people. Thanks, Jane. Let's go to Paris Goutsayanis of the Scotsman.
Thank you, Prime Minister. Nicola Sturgeon's net approval rating on coronavirus is 99% higher than yours. The SNP is on course to win an unprecedented majority in the Scottish Parliament elections next year, and support for independence has never been higher. Do you accept that you, Prime Minister, are the biggest threat to the Union? And if not, why do you think so many Scots want to leave the UK?
Well, thanks very much, Paris. I think, actually, when you look at what's happened under this during this crisis, there has been very good and very close collaboration between, despite the surface differences and the polemics that you refer to, there have been very good discussions across the UK between public health authorities, between the scientific and medical officers, and actually the agenda that is being pursued by all the parts of the UK beneath the surface has been very, very similar. And it's thanks to the strength of the union, I would say, that actually there is we've had the response that we've been able to muster as a one whole United Kingdom, whether that's our armed services bringing testing kits across the whole of the country, taking people in remote parts of Scotland to the testing centres where they needed to go to, or the might of the UK Treasury getting and HMRC getting the furlough scheme up and running across the whole of the UK in a way that I thought was incredibly impressive. So I'm conscious that people will want to try to make divisions, and it's quite right that there should be distinctive approaches in some aspects of the way we approach coronavirus. But I've absolutely no doubt that the Union has proved its worth during this crisis time and time again. The oldest, most successful political partnership in the world, and we certainly don't want to see it broken up. Anyway, Paris, thank you very much for your contribution. Thank you to everybody who's joined us today. Thank you in particular to Dido from NHS Test and Trace. Thank you all for listening.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.